Good day, welcome to another edition of Spotlight on Mahopac Schools. Eric Rose, your host, along with Superintendent of Schools Anthony DiCarlo. And Anthony, we talk about a roller coaster ride in Mahopac. It's been quite the roller coaster these past couple of days.
Yeah, it has been, Eric, and it's something that I think, we spoke to the public about a couple of weeks ago, that things are going to change. We have to adapt and we have to be fluid. And it happens to be that this week we had 2 cases of individuals, one at the Lakeview Elementary School and one at the middle school here. But here's the thing that we've learned, and Shana and Troy and Greg will speak to this in a couple of seconds. We are learning that the state is also learning too, and they're contact tracers. And what we're finding out that originally what they thought might have been the turnaround time is no longer. It's a real good 48 hours that they have to be able to get the information from us, the school district, work with the local Department of Health, and then they send it out to the contact tracers. So what we've learned is minimally our schools are going to have what we call a circuit breaker, and for those 48 hours they're going to have to be on remote learning, both the teachers, the staff, and the students. And then as we get that information, we'll subsequently release out what the next steps are. For example, today, literally before we sat here to tape this, we sent out to the public that the Lakeview School will be able to have half days tomorrow, that's Thursday, Friday, another half day, and the following Tuesday will be half days for the cohort groups, and then the following Wednesday, the 14th, we'll go back to our normal schedule. So it'll be half days. The middle school, we can't do it because of the situation, and again, not having enough staffing. We cannot open the middle school. The middle school will open on Tuesday, October 13th. This is going to happen because depending on the individual or individuals and our ability to cover classes, because what happens is once the investigation takes place, then certain people are quarantined. And depending on those people who are quarantined and the number of days they have to be out, if we don't have enough coverage for those classes, that's what causes that trigger to have to go fully remote.
We have several guests with us today, as Anthony said. We'd like to introduce Troy Billio. He is the COVID coordinator. Believe that? COVID coordinator.
That's one of the state guidelines, and an individual that you need who's become very, very important.
In the Mahopac School District, we have Assistant Superintendent Greg Stoll with us, and a special guest, Shana Siegel, from the Putnam County Health Department will be with us as well. Troy, we'll start with you. COVID coordinator. What is your role in the Mahopac schools?
So my role in this is that when we receive information that there is a confirmed positive case, I will either receive it from the Putnam County Department of Health, or sometimes because they're so busy, it might be a self-reported case, at which point I then have to contact the Putnam Department of Health and confirm it. And so then what happens is once we see that it's confirmed, we then, the Department of Health will ask me who are the individuals that are in that location. It might be some classes, it might be a bus, it might be some staff. I then look to provide that information to them. They then they're the ones then that let me know who we have to send home on quarantine if there's a positive case. I let the building principal know. The building principal in turn will contact the individuals, and if it's students are related to it, then they're going to contact the families and the students would be taken home. So that's the first level. And then what happens is that information is shared with the contact tracers. And the contact tracers, which work for New York State, they're the ones that do the investigation. And what they'll do is they will contact the individuals, ask some questions, and then determine a date that they'll be able to come back to school. And it's known as a letter of quarantine. In this case, if they're quarantined, it'll actually state what they need to do and the date that they can return. And then towards the end of that date, they'll receive a release from quarantine. And it's at that point that they're able to go back into the building, and they bring that to their building administrator to say that everything's good. So one of the things that I just want to say real quick, because we've learned from this, as Mr. DiCarlo was saying, is that when we shut a school down and contact tracers are put into place, some parents were thinking that they would receive a call from the contact tracers. The first step is going to be your building administration that's going to let you know who the impacted individuals are. And so if you are not contacted by your building administrator and sent home on quarantine, then you will not be getting a call from the contact tracers. So with that said, as the contact tracers start to do the investigation, they might see that there are other individuals that are impacted by this, and you might be called.
Greg, what role do you play in this complex process?
I don't think we have enough time on the camera to actually talk about the role, but it's complex. I'm the COVID-19 administrator. I ensure or help ensure that the whole reopening plan, our whole process and procedures run smoothly. So I work with Troy, I work with Mr. DiCarlo, I work with Shannon, I work with all the building principals out there doing temperature checks. So my job is to make sure that our reopening plan stays true, so that all the mitigation factors that we have in place are effective. They're working. If they need to be readjusted, we make some adjustments to it. Our whole job is to make sure that we have all those layers of mitigation. It's not a prevention plan, it's a mitigation plan. And if we do that, and we follow our processes, our procedures, we cohort, we do our contact tracing, our hope is we keep our schools open as long as we can, and have minimal disruptions. As Mr. DiCarlo said, there's some things out of our control, but the whole district didn't shut down. We were able to make individual decisions working with the partners at the Putnam County Department of Health to at least have the other buildings open. So that's my job in a nutshell.
A few more gray hairs this year.
A lot more.
So I think, Eric, what's really important, and it was mentioned by Troy, and I know Shannon will mention it in a second, is that each case is separate unto itself. If there, for some reason, is a larger cluster, the Department of Health would let us know that, because that's when we're talking about all the schools being shut down. Right now, these two cases, and there's been others, and I think what's important for people to understand is the dashboard is there for you to go to take a look at. We are not going to be telling you how many people were quarantined at this building. We're not doing that. We have to report what we need to. Sometimes, and this happened initially, there were some reports on the dashboard for individuals who weren't even in the building, right? Because then that can happen. You know, we have kids that are on remote learning. So there's the assumption by the public all the time is, oh my God, look at all these cases and see what's going on. But each case is individual unto itself. And I will tell you, we're very fortunate, because back in March of last year, we have developed a relationship. And being a small county, we're very blessed in that way. Because, Shannon has been wonderful. Myself and my other superintendents have been on with her, and Frank Guglieri from BOCES almost every single week. We're updating, we're trying to be proactive. Any of us here, myself, Greg, or Troy, can pick up the phone and have a great conversation with this young lady, and we'll always problem solve it. And we're learning together. One of the things that we talked about this week as superintendents was we knew that 24-hour window wasn't going to work. And we had talked about, for now, it makes sense so parents know, if we get a positive case, we're going to have to shut down to do that tracking for 48 hours, and we're going to go to the circuit breaker, and we're going to go to remote learning. And then based on the information we get, we'll take those next steps. But that's really important, because each case is very different.
Shawnee, you're working closely with the schools, as Superintendent DiCarlo said. What message do you have to parents out there whose children might have a little scratchy throat, a headache? What do they do?
Well, I'm one of those parents. I'm a parent in Putnam County, not in Mayapack schools, and I face the same challenges. I'm screening my daughter at home before sending her to school. I'm taking her temperature, and I'm making sure that I establish a relationship with our healthcare provider, and that I can get in and get seen, or have a televisit, either telephone, or we can have a virtual visit if I have any questions. And now that the state has released a toolkit, we as parents can actually refer to a flow chart to discover, should I send my child to school today or not? And there are very clear questions and answers that we can ask ourselves and our children to decide if they can go to school with whatever they've been experiencing.
And it's always better to be safe rather than sorry.
Absolutely. What everybody's been going through in Mayapack schools and kind of all over the state and the country that we're experiencing is finding and identifying a positive case, isolating that case, and then tracing the case. And once you identify the contacts, quarantining those contacts. But the more careful we all are as parents and community members, the less our schools will be faced with all of the work that goes in to identifying, isolating, and tracing. And as Anthony said, kicking over to that circuit breaker and going all remote. So if we do our part and keep our children home when they're sick, or if we've traveled out of state to an area that has a high incidence and is on New York State's quarantine list, not to send our children to school. And outside of that, Eric, I really want to urge people to continue to social distance and wear your masks. I know it's been a very long time. It is emotionally trying for all of us, but our schools are doing everything they can to be the safest place possible to mitigate the spread of this, and we have to do our part outside of the school day.
Shannon, can you do me a favor? Can you explain to the public a little bit about the 14-day quarantine? Because what happens is people are seeing people leave, but then they're coming back before 14 days, but it's not about the contact, it's about the actual positive case. Can you kind of give an example of what that may look like?
Yeah, absolutely. So it's a great question. We'll say that somebody has tested positive and they're symptomatic positive, because we know that people can test positive while asymptomatic, but let's start with a more obvious scenario. So somebody tests positive, we go back 48 hours prior to symptom onset to identify contacts. Through case investigation, we might find out that somebody actually had a headache earlier than they had identified other symptoms. So from that first symptom onset, 48 hours prior, all those people, we need to identify, and we need to identify them as contacts, get the information to New York State contact tracers, so that they can get information on how to safely quarantine. Their quarantine period is 14 days from the last date, and I don't know if you can tell I'm smiling here because this is a lot of information, but 14 days from the last date that they were exposed to that positive case. So if we only find out about this person or get the test result from the positive case 7 days later, then that contact of the case will only have 7 days remaining in their quarantine. The complicated piece here is, if that wasn't complicated enough, is if it's a scenario where people live together. A parent is positive and a child is the contact. The parent has to isolate from the child their whole period of isolation. And the child's quarantine begins the first day that they no longer have contact with their parent. And that's incredibly complex for many families.
When you say isolate the child, the whole family then would have to be isolated.
So technically the correct way to say it is that a positive case isolates and contacts of the positive case quarantine. And there are different requirements for that. The isolation period for a positive case is 10 days at minimum. And then symptoms improving in 72 hours fever-free.
You know, Shauna's wearing her Wonder Woman mask today. She's a
Yeah, I
Wonder
know,
Woman.
she is. But I want to echo and I want to go back to Dr. Stowell on this. And this is why it's so important to do the easy screen, because it will let you kind of get into a groove to say, oh my gosh, like if my son or daughter has one of these symptoms, they better not go in today. So, want to talk about that, Dr.
Sure.
Stowell? Because that's important.
So part of our mitigation technique is to have everybody just check with themselves, staff and students, or parents and students, have them check their symptoms every day. Take their temperature, look at our COVID-19 screening questions. Shannon talked a little bit about them, and really self-report every day. So all staff members have to report before they come to work. All students, the days that they're physically in school, will have to self-report, and we use a tool called Easy Screen. You can download it as an app on an Apple iOS, or there's a URL for this tool. And the interface on the URL using a PC looks exactly the same as the app on the Apple. So all families have been sent an invite. If you haven't, please put a parent help desk ticket in, the same ones you do for a Chromebook, and all staff members have been sent an invite, and we started on the 5th. And so filling that every day will ensure that you're filling it out for your child or yourself if you're a staff member. If you're symptomatic, it tells you to stay home. Contact your supervisor and then report your absence. And if you're a family, if you're a student, contact the school as you normally would and report your absence, and the nurse will get back to you. Keeping kids, staff members who have any symptom, and many of those symptoms can look like COVID, may not necessarily be COVID, but keeping them out will keep our schools open, because if you come to school symptomatic and we have to isolate you and send you home as a staff member or student, that means we got to report it to a COVID coordinator, we got to report to the Department of Health, and all of a sudden contact tracing kicks in, and everything Mr. DiCarlo said happens at that point. So we need to make sure that if you're not feeling well and you have any symptoms, you stay home. And if you're feeling well enough to work or you're feeling well enough to go to school, you can do that virtually in speaking with your supervisor or speaking with your classroom teacher.
And what about speeding up the process when somebody is tested? What is the turnaround now?
You know, Eric, that greatly varies from location to location and week to week. So we know that there are some places that can produce results for PCR testing, for molecular testing, within 2 to 3 days. But if they get backlogged, we've seen that take even longer. And at the highest rate of incidence in our county, it was taking almost 2 weeks at times. We hope that doesn't happen again now that we have rapid antigen tests that are possible, and that can be acceptable in most circumstances, not all, to accept a negative antigen test. So some of those will be rapid in-office tests, similar to if you get a rapid strep in the office, and they'll give you the primary results, and they may send out another test to a lab to confirm those results.
This is what you've been talking about from day one.
Yes,
This
and
turnaround.
yes, and again, I mean, we just don't have control of it. We have to do what we need to do, but then, you know, others are gonna determine when we can do certain things and welcome kids back. But if, Shannon, if you wouldn't mind, I think we've learned this too, and if Troy, you need to come in, can you please let the public know about what some of those questions are when it comes to whether or not you are somebody that could be, you know, when we talk about the square footage of the room, we talk about ventilation. Could you kind of tell the public what some of those questions are that will determine whether a person is that contact or direct contact? Because I think that would be great for the public to understand.
Yeah. I'll begin by saying that in the school setting, the guidelines are much more strict than they are in other public settings. So it may not be the same if you were exposed at work as it is for our staff and students in school buildings. The guidelines that schools have to follow with physical distancing of 6 feet and mask use, our school districts in Putnam County have decided they're doing both. The guidelines by the state say when you can't maintain the distance to have the masks. But we have discovered through positive cases statewide that in a classroom setting, no matter the time that has elapsed, or the spacing, or the mask use, that we're really taking that extra cautious route, and anybody who's been in a class with a positive case for that class period will be quarantined. That's not always going to be the case in other settings, of course, like I said. So distance, masks, and of course ventilation. So different wings of a building, different classrooms may have different ventilation where the windows open. And we're finding this to be the case as well on transportation. So it's very important on buses, as we get into the colder weather, to make sure that people are dressed appropriately, because we're really recommending that the windows stay open and that we can maintain ventilation and spacing. And to allow our transportation departments to know that if a bus is not filled to its new capacity, which is different than its former capacity, that students should be encouraged to spread out so that we can decrease the likelihood that an entire bus would have to quarantine if there was a positive case.
Thank you, Shannon.
Anyone with questions out there, who do they contact? Want them to contact the school, contact Shauna?
Well, depending if it's an issue, and I'll throw it over to Troy, a little bit about what his role is, because he mentioned it before. But before we go to him, I need people to understand this. This goes for students and the staff. And I sent a letter home this Friday. You have to be ready any day for an emergency dismissal. That means you have to have your stuff ready with you to go home, whether it's an early dismissal that day or you get a letter or phone call that we're closed the next day. You gotta have your Chromebook. Teachers, you gotta bring your stuff with you, because once we do that 48-hour close down, nobody's coming back in the building, right? Until we get the further understanding what's going on. So you gotta be prepared literally each and every day that it could be that next day you're not there. I know that's not something that people wanna hear, but that's kind of the reality. So going back to your question, I'll turn it over to Troy, because he mentioned before about if you're not sure, you can always contact and he'll let you know who you can contact.
Yeah, so you can always contact me. I'm located at the Mayapack Falls School. My extension is 13504. or you can email me. And if there's any questions that you have, I would be your first point of contact for the school district.
You also want to let them know, Shannon, I don't know if this is because this has happened now before. If you see that number, please pick up the phone. Is it 551?
It's a 518 area code number.
Yeah, 518 area code, because that sometimes is, and we're hearing this across the state and with my other colleagues in other schools, as they're doing this contact tracing, and it says it on our letter. If you see a 518 number, that is probably the state asking you for some information. Pick the phone up, because the longer that gets delayed, and if they have to keep getting you, that's going to delay our process. Right now, it's 48 hours. If the state continues to get inundated, it may now be 72 hours or more that we have to close. So we want to make sure to the best of our ability, as Shannon said, we're trying to help the process along. It's really, really important. Dr. Stoll, do you want to add anything else?
No, and then, you know, not only that, questions about whether you should send your kid to school or not, call your school nurses. They work with the Putnam County Department of Health, they work with our school district physician. You know, always start at the building level. And then, you know, you'll get your answer much quicker. If it's about health and safety, about how your building is operating. Our building principals have done a remarkable job, Mr. DiCarlo, on getting our buildings ready for our first full week of hybrid. Despite this setback in a couple of the buildings, everything else has been incredibly smooth. So our teachers and our building principals and our custodians and our monitors done a wonderful job. So start at the building level. And then at that point, if you have big generic questions about what does this mean for me on contact tracing, or how will I know if my kid has been exposed, those you can speak to Mr. Billio, contact him via phone or via email.
Well, we'd like to thank Troy Billio and Greg Stoll, and of course our special guest Shonda Siegel, for joining us today for this rather informative edition. They're informative. This is super informative.
Yes, very
of
much so.
Spotlight on Mahopac Schools. For Superintendent Anthony DiCarlo, I'm Eric Bruce. Thank you so much for joining us. We'll see you all the next time. Be safe. Bye-bye now.
For more information, please visit our website, www.mahopac.k12.ny.us.